Dr. Monica Bharel, Commissioner of the state's Department of Health, joins me now. Thank you for your time, Doctor, this morning. The governor just announced 2 new mass vaccination sites that will be opening by the end of the month. How would you say the vaccine rollout is going, and do you think there's room for improvement?
So thanks so much for covering this important topic. We're working every day to improve the processes and taking back information from our communities and making sure that we, as you said, open more sites, improve our the smoothness of our processes. And just in the last week, we've started a call center, which is taking thousands of calls to be able to help individuals navigate the website. There are multiple new pharmacy sites that will be opening up soon. So we're really working to improve our processes. The truth of the matter is that, unfortunately, I understand the frustration because there is much more demand for the vaccine than there currently is supply, but I'm hopeful that that will continue to improve as well.
Earlier this week, the governor announced that some vaccine appointments weren't being filled. We saw this happen just yesterday in Danvers. There was a situation there where they were trying to get people to come immediately to get the vaccine. So does this mean that there are extra doses available, or just that not enough people are making the appointments at any given time?
It's a mix of things. And what I really would like to emphasize that if you are in phase 1 or if you're 75 and older, that's the current group who's eligible to get vaccinated, to go to our mass.gov COVID vaccine site so that you make an appointment. I also want to make sure, today alone, today's Thursday, we'll be opening up over 74,000 appointments. So I really encourage individuals who are eligible to get vaccinated. About half of the individuals in Massachusetts who are 75 and older have been vaccinated so far. I also want to make sure that people understand that please only go to a vaccine site if you have a scheduled appointment to make sure that you're able to get a vaccine.
Well, we saw yesterday that sites can give leftover doses to people who are not in the eligible group. So can you explain the process behind that new guidance?
So in general, our goal is that no vaccine dose gets wasted. So it's really important to us. Luckily, wastage is something that must be reported to the state. And we see that it's far less than 1% of doses are wasted. So there are guidances at each site to make sure that the vaccines are used. And we've been working with each one of the mass vac sites to make sure that their processes are running more smoothly and that the signage and the directions are clearer. But my advice to individuals is to start at the website and please go to the website to make a scheduled appointment.
Okay, Dr. Monica Bharel, thank you so much for your time this morning.
Thanks for having me.